Hello, I'm Anne Marie Wallace, Community Outreach Senior Coordinator at Baptist Memorial Healthcare, and I am pleased to welcome you to a Baptist Healthy Communities webinar that is featuring Queen Cox Taliaferro, a registered dietitian who has worked at Baptist Memorial Hospital for Women and Baptist Children's Hospital and is employed by Compass One Healthcare. Please sit back and enjoy her informational session on nuggets to help you manage heart disease and type 2 diabetes. Thank you.
Hello, my name is Queen Cox Taliaferro. I am a registered dietitian. Today, I would like to speak with you regarding nutritional nuggets for the prevention of cardiovascular disease and our type 2 diabetes mellitus prevention. Heart disease is the #1 killer of women in the United States. Every woman can take steps to prevent heart disease by making healthy lifestyle changes. And today, I'd like to talk about nutrition in regard to cardiovascular disease. When it comes to nutrition, the new dietary guidance encourages, when designing a meal plan, a healthy diet and lifestyle are two key factors in preventing and or managing cardiovascular disease. It's not as hard as you think. Simple diet and meal plan changes can add lifetime benefits both to the heart and to your health. Another risk factor in regard to women's health is diabetes. About 1 in 3 Americans experience prediabetes. Prediabetes is a transition to type 2 diabetes mellitus. Although with important lifestyle changes, type 2 diabetes mellitus can be prevented and or delayed. Prediabetes occurs when the cells in the body doesn't properly use insulin, therefore causing glucose impairment or insulin sensitivity. There are different tests that can confirm the diagnosis of diabetes and or prediabetes. Hemoglobin A1C is a test that can be run. Random blood glucose monitoring and testing. And for pregnant ladies who are pregnant, an oral glucose tolerance test is available for detection of diabetes. And if you're pregnant, it's called gestational diabetes. Contributors to diabetes or prediabetes include obesity, lack of exercise, and our high calorie diets, and having a family history of heart disease or type 2 diabetes. As consumers, we're encouraged to make a serious effort to improve our health habits by learning about healthy eating and healthy cooking skills. And of course, if you're not already active, get moving. Regular exercise can help you maintain your weight, keep off the weight that's been lost, and with reaching physical and cardiovascular fitness. Especially on today, I wanted to talk about the basics of nutrition that will help aid with eating smarter in order to prevent cardiovascular and or diabetes and related illnesses. Nutrition and calorie information that's found on food labels is usually based on a 2,000 calorie meal plan per day. You may need more calories or you may need less. It depends on several factors, such as your age, your gender, and your level of physical activity. The recommended methods for food prep in regard to our meats are baking, broiling, and or grilling lean meats, such as poultry and fish, with up to 6 ounces a day of meat consumption per the American Heart Association guidelines. We encourage more of our consumers to eat fruits and vegetables, more low-fat dairy products, and or include nuts in their diet. Also encouraged are more whole grain foods, such as brown rice, whole wheat breads, and oatmeal. There are also foods that we encourage you to eat less of, which is our processed foods that you find readily available in the microwavable or the ready meals, in our biscuits, sausages, bacon, and our salami and hams. Uh, One message today that we'd like to encourage our consumers is to 3/4 of your plate should include vegetables. And we like to add vegetables, fruits and vegetables, add color to our plates. And fruits and vegetables have many added benefits for providing nutrients for our bodies, such as fruits and vegetables with our meals and snacks give us a healthy and energy boost. And fruits and vegetables have less of the bad things that we try to avoid in our meals, such as the salt, the trans, and the saturated fats. Therefore, as consumers, we can load up on fruits and vegetables. Fruits and vegetables provide our whole body a health boost due to less chronic diseases such as cardiovascular diseases, diabetes, and high blood pressure. And also, there's less obesity because fruits also have a tendency to have more fiber and a higher water content in them. And that helps us to feel full sooner with the benefit that it's a lower calorie food item. As a registered dietitian, it is possible to follow the American Heart Association guidelines, whether the food is prepared at home, at our restaurants, or simply by ordering foods online. The American Heart Association has a heart check certification program app that can be downloaded in order to assist with grocery store shopping list. And it can also help us to verify the food products nutrition label values to see if it meets our heart health checked for nutrition requirements. One might ask, what are the advantages to using this heart check app? Well, it's heart checked, of course. It's science-based. It's transparent. The information is readily available for consumers to see it on the website. Also, this information is strongly monitored and it's enforced. And we have staff that validates the product's nutrition label values in order to meet the heart check nutrition requirements. So therefore, it puts us at ease. And the heart check is easy to spot and use, and it takes the guesswork out of reading the entire food labels. So the results speak for themselves as well. Research has shown that consumers who do use the heart check certification tend to eat a little healthier, and they also have a tendency to be at less risk for some of the heart disease factors. Now I'd like to take a few minutes to focus on some of the American Heart Association's guidelines for fats, sugars, and salts. And first, we'll talk about our fat consumption. And when we refer to the word fat, it's also called fatty acids or lipids. Our body uses fat as a fuel source, and it's one of the major storage of energy in the body. Understanding the different types of fat and what the American Heart Association recommends for the heart health helps us to make healthier choices. For example, if we're following a 2,000 calorie meal plan a day, then no more than 120 of those calories should come from saturated fat. That's about 13 grams of saturated fat per day, in other words, 6%. The good choices, the good oil choices that we can select include avocado, canola, corn oil, grapeseed, olive oil, peanut oil, safflower, and sunflower oils. Consumers are encouraged to limit commercially fried foods and baked goods made with shortening or partially hydrogenated vegetable oils. These foods are very high in fat and are likely to contain trans fat. Look at some of the products, look for processed foods made with unhydrogenated or oils rather than saturated fat. Or you can look for partially hydrogenated and mostly oils that say vegetable. Also, using soft margarines as a substitute for butter is recommended. Liquid, if it says liquid or tub varieties, over the hard stick forms of margarines. Look for zero trans fat for the nutrition on the nutrition fact label. Replacing less healthy fats, such as saturated fats and trans fats, with unsaturated fats, such as monounsaturated fatty acids and polyunsaturated fats, may offer health benefits, such as lowering the risk for heart disease and or strokes. And it also lowers the LDL, which is the bad cholesterol, and it increases the HDL, which is the good fat. The next topic of focus is sugar, which is a form of carbohydrate for the body, which converts to glucose. The American Heart Association recommends no more added sugars than 6 teaspoons for women, which equates to about 100 calories per day, and basically about 9 teaspoons of added sugars a day for men. That equates to about 150 calories a day. And we can look at the food labels in order to identify some of the added sugars, as well as letters ending in OSE, as fructose, which is a fruit sugar, and lactose, which is an added milk sugar, and we have sucrose, which is a table sugar. So replacing the added sugars with cinnamon or some of the spices, such as nutmeg, while adding fresh and dry fruits to food items like our cereals or our oatmeal. And when you have a large consumption of sugar in the diet, as well as those sugar-sweetened large beverages, it does contribute to obesity, high blood pressure, high cholesterol, diabetes. They're all linked to consuming a diet high in sugar. For example, 1 teaspoon of sugar is equivalent to 4 grams of sugar, but the simple sugars like glucose, fructose, sucrose, and lactose are the ones that we need to look for. There are some good sugars, such as complex carbs, such as our grains, and that we've talked about. Our next focus will be salt. And salt is a mineral. Salt and sodium are oftentimes used interchangeably, but they're not exactly the same thing. Table salt is a combination of sodium and chloride. By weight, it's about 40% sodium and 60% chloride. Because the average American consumes greater than or equal to 3,400 milligrams of sodium per day, just by cutting back perhaps 1,000 milligrams a day can significantly improve our blood pressure and heart health. There are different levels of blood pressure categories, so knowing the numbers and when to seek medical treatment is crucial. The American Heart Association recommends less than 1,500 milligrams of sodium per day. So one might ask, where does sodium come from? Well, 10% of sodium comes from when we cook our foods or while we're eating our foods. 15% occurs naturally in the foods we select, and about 70% comes from restaurant and or the processed foods. Sea salt has become popular in our restaurants. We also find sea salt in some of our snacks. Some people choose it because it has minerals like magnesium, which magnesium is said to help keep our blood pressure normal, and it helps to keep our bones strong, and it helps to keep our heart rhythm more steady. Our last focus point is learning how to keep track of what we eat. That can have many, many added benefits. For example, it creates overall awareness of what we're eating. It creates accountability. It shows you what you're doing well, and it shows us what we're not doing well. And it shows you how much and how often we're eating. And it helps with weight loss, and it helps detect food intolerances. We have discussed some healthy lifestyle choices that hopefully will aid with your path to a healthier heart. When it comes to our health, self-care can be as easy as eating a red, delicious apple on most days, or by taking a walk on a sunny day. The recommendations that we've discussed today is a step-by-step blueprint designed with the American Heart Association's science-based recommendations. I'd like to encourage you to make small baby steps as part of your daily routine in order to aid with the prevention of cardiovascular, type 2 diabetes, prediabetes, and or other related illnesses. Thank you.